Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
Welcome back to the Deep Dive. Now, just before we jump in, a quick note for everyone listening. This deep dive was created using generative AI tools. We use them to support accessibility and clarity, and importantly, the content you're about to hear. It's firmly grounded in the extensive research and instructional work of Dr. Michael Jones. Today, we are plunging into a topic that's, well, it's not just important, it's genuinely reshaping the landscape of mental health practice. We're talking about telemental health assessment and intervention strategies. It's really changing how we connect and deliver care.
That's absolutely right. It's a huge shift. Our mission for this deep dive really is to kind of peel back the layers on digital tools in mental health. How reliable are they? How valid? And also to navigate the evolving ethical side of virtual practice. Plus explore how established evidence-based interventions are adapting and, often thriving online. We're drawing heavily from a comprehensive key terms and topic overview document, which gives us a really solid base for this discussion.
Okay, let's unpack this then. We hear the term telemental health, or TMH, tossed around quite a bit these days. But what exactly does that mean? What's the core definition we should be working with here?
Right. So at its foundation, telemental health, TMH, is essentially the delivery of mental health services using telecommunications technology. Pretty broad, right?
Yeah.
But it's crucial to understand this isn't just about, say, talk therapy over video. The scope is much wider. It includes assessment, diagnosis, consultation, treatment, even educational services. Hubley and colleagues defined it this way back in 2016. It's really about using tech to bridge gaps, physical distance, logistical hurdles.
Got it. So definitely more than just hopping on a video call. How does this digital interaction actually happen? Are there specific modes or maybe concepts we need to grasp?
Absolutely. There are a couple of key operational concepts that really define how TMH services are delivered. First, you've got synchronous modalities. Think of these as the real-time live communication platform.
Like video conferencing.
Exactly. Video conferencing is the big one, but also things like live chat systems. The key thing is that immediate back and forth interaction. It helps foster that sense of shared presence, even miles apart. Schoederman and Bush talked about this in 2023, the importance of that real-time connection. And then there's this other concept, digital presence. This one's quite interesting, actually. It's more than just being online.
Okay. What does that involve?
It refers to the therapeutic connection and the engagement that you build and sustain virtually. Daisy, in 2023, described it as covering both the technical side, a stable connection, clear audio, that sort of thing, and critically the relational elements. How do you actually establish and maintain that therapeutic bond when you're talking through a screen? It's about forging a genuine connection just digitally.
Okay, here's where, for me at least, it gets really interesting. For so long, in-person assessments felt like the gold standard. How have assessments genuinely transformed in this digital format? And maybe the biggest question on everyone's mind is, can we actually trust them? Are they reliable?
Ah, yes, that is the question, isn't it? And the evolution here is pretty profound. It's not just about taking an old paper test and sticking it on a tablet. Our sources really describe it as a reimagining of therapeutic engagement. It definitely expands access, which is huge. But the goal is also to maintain clinical rigor. And, in some quite compelling cases, even enhance it.
Enhance it. Wow. Okay.
Yeah. So when we talk about trusting these digital assessments, we're getting into digital assessment reliability. Basically, how consistent and accurate are these psychological or cognitive tests when done digitally? The main statistic we use for this is the intra-class correlation coefficient, or ICC.
ICC, right.
And just to give you a benchmark, an ICC value over 0.75 is generally seen as good. And if you get above 0.90, that's considered excellent for clinical assessments. It's our scientific way of showing these tools measure consistently.
And the data we have on this sounds like it's pretty strong.
It's incredibly compelling, actually. Research is showing that digital assessments aren't just matching in-person reliability. Sometimes they're exceeding it. For instance, some digital cognitive assessments are frequently getting ICCs over 0.93.
0.93. Wow. And how does that compare?
Well, compare that to the typical range for conventional in-person measures, which is often somewhere between 0.51 and 0.87, that's a potentially significant jump in consistency.
And this isn't just theory, right? There are practical examples.
Exactly. It's not just theoretical.
Yeah.
Look at findings from Katz and colleagues in 2023. They studied digital cognitive assessments with community-residing older adults. They found really high compliance rates, 88% overall. And critically, the performance was consistent across different demographics, race, ethnicity, education level.
That's really important, consistency across groups.
It is. And then you have research by Hun and others in 2024. They found that even remote self-administered assessments showed moderate to good agreement with examiner-administered versions. The ICCs there range from 0.59 to 0.83. So the takeaway seems clear. These digital tools are proving remarkably dependable and, frankly, quite practical.
That does make a very strong case for integrating these tools more routinely.
It really does. It shows we can expand access without necessarily sacrificing quality. And this is an important but, we also need to think about virtual assessment validity. Reliability looks strong, yes, but we still need to carefully consider population-specific factors. Just because a tool is reliable doesn't automatically mean it's valid, meaning measuring what it intends to measure for every single group or context without adaptation.
That distinction makes perfect sense. Reliability and validity aren't quite the same thing. So if we're using these powerful, reliable digital tools, how does something so fundamental like cultural competency play out? Especially when the therapeutic space is virtual, what new layers pop up when you're not in the same room, maybe missing some of those subtle nonverbal cues?
That's a crucial and honestly complex question. Cultural competency, as Gupta and colleagues defined it in 2023, is fundamentally about delivering services that respect and respond to diverse health beliefs, practices, cultural needs, linguistic needs. Now, take that into a virtual environment. It suddenly expands way beyond just language.
How so?
Well, you have to recognize that things like technology access, digital literacy levels, even people's cultural attitudes toward interacting virtually, these can vary enormously across different communities. What feels comfortable and accessible for one person or group might feel alienating, maybe even disrespectful to another.
You mean like assumptions about internet access or devices?
Exactly that.
Yeah.
We can't just assume everyone has reliable high-speed internet or the latest smartphone or even feels comfortable being on camera. This digital divide is a huge cultural consideration in TMH. And beyond the tech, communication styles themselves differ so much culturally. A direct question that might be fine in one culture could feel blunt or rude virtually, without the usual nonverbal softeners. It demands an extra layer of awareness from the practitioner.
It sounds like it requires much more intentionality from the therapist's side. I remember seeing an example in the source material about remote psychosocial art therapy groups spanning international boundaries.
Yes, that study by Valdizuoli and Volman in 2023, it's a great example. It showed that culturally responsive virtual interventions are possible, even across significant cultural divides. But you can just imagine the immense thought and careful planning needed to ensure genuine cultural proficiency in that kind of setting. It really highlights the need for practitioners to develop this sort of heightened awareness of cultural nuances, things that might be much less obvious virtually compared to being in the same room. You can't just rely on the shared physical space or ambient cues to convey understanding. It forces a much more deliberate approach.
Okay, so that's assessment and cultural competency. Let's shift gears slightly to intervention. How are these evidence-based interventions, the therapies we know work, actually adapted for digital delivery? And maybe more importantly, do they keep working? Does the screen diminish their impact?
That's another critical area. The adaptation process isn't just, doing the same thing, but on video. It's really about preserving the core components, the mechanisms of change that make an intervention effective, while also creatively leveraging the unique features that digital platforms offer. It's a translation, really. Think about cognitive behavioral techniques or solution-focused interventions, even psychoeducational strategies. Permana and colleagues noted in 2023 how these have all been effectively modified for both video and even text-based delivery. It takes understanding what makes it tick and how to deliver that digitally.
Okay, but the million-dollar question for practitioners, and probably clients too, is, are the outcomes truly comparable? Does it work as well as seeing someone in person?
And the research here is remarkably consistent. The answer seems to be yes. TMH interventions are achieving comparable outcomes across diverse populations and different settings. For instance, there was a comprehensive analysis looking at community mental health services, and it found no significant difference in symptom improvement trajectories between clients receiving TMH and those getting in-person care. And this was even in settings where people hadn't had much exposure to virtual care before. Harris and colleagues found this in 2023. That's a really important validation.
No significant difference. That's huge.
It is. And beyond just the clinical effectiveness, there are often substantial economic benefits too. Hubley and colleagues pointed this out back in 2016. Things like reduced travel costs and time for clients, definitely expanded access for people in remote areas, and even potentially decreased infrastructure needs for providers.
Can you give an example of those benefits in action?
Sure. A really compelling one comes from the U.S. Department of Veterans Affairs. They reported significant reductions in psychiatric admissions and total hospitalization days for veterans enrolled in their TMH services between 2006 and 2010. So that illustrates both potential clinical gains and significant economic advantages. It supports the idea of TMH being sustainable on a larger scale.
That's a really powerful case for TMH, both clinically and economically. So, wrapping our heads around all this, what does it mean for ethical practice? The modality changes, do the standards shift? What specific ethical guidelines do we really need to zero in on for telemental health?
That's foundational, absolutely.
Yeah.
Ethical compliance in TMH isn't about throwing out the old rules, but it does demand expanded attention. Issues like informed consent, confidentiality, and ensuring practitioner competency, they take on new dimensions. Our existing ethical codes provide the framework. The ACA Code of Ethics, for example, Section E from 2014, gives guidance on testing and appraisal. These principles absolutely apply, but they need to be applied with extra care and thoughtfulness in digital settings. You have to think about data security, platform privacy, things like that.
So, applying existing principles with new considerations, are there TMH-specific standards too?
Yes, definitely. The National Board for Certified Counselors, the NBCC, has standards specifically 58 through 68 that directly address the competent use of assessment tools across different modalities. This basically means practitioners need proficiency, not just in traditional assessment, but also in the technology-specific applications used in telemental health. It really underscores this idea of needing a dual competency.
Dual competency. That makes sense. So, related to that, are the documentation requirements different? Do we need to record different things for virtual care?
That's a great question. And yes, documentation in TMH often needs to go beyond the traditional clinical note. It's really crucial to include details about the specific platform used, maybe any technical issues that came up during a session, like a dropped connection, for instance, and also note any adaptations you made specifically for digital delivery. This kind of comprehensive documentation ensures ethical compliance, shows your due diligence, but it also acts as a quality assurance measure. It makes your clinical decision-making transparent and defensible, no matter the modality.
Okay, let's dive a bit deeper into that dual competency idea.
Yeah.
Given all these layers, the tech, the cultural factors, the ethical nuances, what kind of professional development is really essential now? How do we make sure practitioners are not just, okay with TMH, but truly proficient?
This is where guidelines like the NBCC, FBC-TMH competency domain for client practitioner protocols are so vital. They really emphasize this dual competency. It means practitioners need skills in, say, technical troubleshooting. That's part of the job now. They also need proficiency in building that therapeutic relationship virtually, which can feel different. And, of course, adapting interventions effectively for digital platforms. But, and this is key, they have to do all this while maintaining their core traditional clinical skills. It's an integration, not a replacement.
So training needs to cover both the tech skills and the adapted clinical skills.
Exactly. Training programs really have to tackle the unique challenges of creating that strong virtual therapeutic presence. Things like learning to interpret nonverbal cues differently through a screen, learning how to manage technical boundaries. What do you do if the connection drops during a really critical moment? And adapting crisis intervention plans for remote situations. That's crucial. Developing these competencies isn't just about reading manuals. It needs supervised practice, ongoing consultation, making sure the tech enhances the clinical work, not hinders it.
It's clearly a lot to integrate, but also seems like where the field is undeniably heading. So, looking ahead then, what are some of the emerging directions? Where is telemental health likely going next?
Well, the evolution is definitely ongoing and rapid. We're already seeing really interesting developments, things like the integration of artificial intelligence, AI, into assessment protocols. That could potentially revolutionize how we analyze client data and personalize interventions. Then you have virtual reality, VR, being explored for things like exposure therapy, creating incredibly immersive controlled environments, and mobile health apps. for continuous monitoring and maybe even delivering small interventions between sessions.
Some more integration of advanced tech.
Right. But the critical piece with all these innovations, AI, VR, mobile health, is the ongoing need for rigorous evaluation. We constantly need to assess their real impact on therapeutic effectiveness, ensure they meet ethical standards, and check their cultural responsiveness. The field is dynamic, absolutely. So that continued vigilance and research are just paramount to ensure we're innovating responsibly.
This has been such an insightful deep dive. It really highlights how telemental health has become this robust, effective, and often cost-efficient way to deliver mental health care. But as you've made so clear, its success isn't automatic. It's not just about having the technology. It really hinges on a deep understanding of assessment reliability, a strong commitment to cultural responsiveness in that virtual space, strict adherence to ethical guidelines, and absolutely an unwavering dedication to continuous professional development. It's an incredibly powerful tool, but one that really demands skillful, thoughtful, and constantly evolving application from all of us.
Well said. And as you, our listeners, think about today's topic, maybe consider these 2 questions for yourself. First, how might the principles and practices of telemental health assessment and intervention, the things we've discussed, show up in your current work or your specific role? And second, thinking about that, what, if anything, might you want to approach differently in your own professional practice moving forward, given the insights from this deep dive?